Okay, so I'm going to talk about cities and health, and in particular urban design and physical activity. So this slide shows how environments have really changed through our evolution. We spent most of our evolutionary journey on the other side here in savannas, open areas where we spent most of the time as hunters and gatherers, and more recently in these urban jungles where we sit most of the day being sedentary. So our genes don't fit really our lifestyle anymore. And as mentioned, the rise in urbanisation, people living now in cities in compact urban jungles has increased. In approximately 2010, you can see that the red line, the world urban population, has now increased in terms of world rural population, and especially in the countries like Australia, and particularly China, there's vast mass movement into urbanised areas. So this is now the social norm. We don't really do much except getting out of our cars. So from a physical public health perspective, we think that the best form of medicine is basically to get on your bike and do more walking. And we know that that protects from a lot of chronic diseases, heart disease, certain cancers, type 2 diabetes, for example. But we know that our urban form actually either helps us be more physically active or actually can be deterrent to be more physically active in terms of walking and getting active transport. So this example shows on this side a compact city with grid-like structure where you can actually walk easily to where you want to get to, as opposed to the other one where you have to sprawl and walk through different cul-de-sacs to try and get to A and B. So you're obviously not going to walk much in that environment. Last month we published with co-researchers from across 10 different countries and 4 different continents in The Lancet a study that looked at how active and friendly neighbourhoods were in terms of physical activity, and we looked at all different types of urban forms with all different types of culture. And we found that really our health is a function of where we live, and there were 4 key environmental aspects that were positively associated with higher levels of physical activity. Those living with more parks within walking distance, the higher residential density, easier access to public transport, the number of buses or rail stations, and the higher number of street intersections that pedestrians had access to. So taking that from the international context, looking into Canberra, what do we see about walkability in Canberra? This shows the walk score, which is basically a composite of all those measures I just said. And you can see that here that the grey-brown areas are more car dependent, and only the green areas and the shaded light green areas are walkable in Canberra. So that gives you an idea of how we rely on our cars in terms of how we get about the city. So living in what we did then is to look at how those walkable areas impacted on our health and health outcomes, and we looked at hospital data over the last 7 years, public hospital data for what conditions people are hospitalised for, and we found that after you adjusted for confounding factors, living in highly walkable neighbourhoods such as Civic, those green areas that I showed, was associated with a 4% lower risk in hospitalisation for heart attack relative to those living in the less walkable neighbourhoods, and the risk of being hospitalised with specific lifestyle-related cancers increased with residents who were in less walkable neighbourhoods. So it really does make a difference on where you live and how the built environment facilitates that behaviour. What we didn't have in those studies, of course, is how people actually behave in their neighbourhoods. We didn't have any information on how people got from physical activity through use physical activity to interact with their neighbourhoods. And we're now using the new technology, the quantified self. We've all seen the apps. We can measure literally everything from our sleep patterns to the number of steps we've taken to our alcohol, and even where we've been using GPS. And so I've just given some examples looking at GPS. People are now doing art with their GPS activity monitoring, which is really cool. But we're actually developing a web-based open data commons funded by the CBR Innovation Fund to allow people to have access to this sort of data at an aggregated level. So anyone that wears a fitness fit or an activity tracker can download and share their data. So we're trying to look at different typologies and how people interact and benchmark against different people in different suburbs to give us more idea about the physical activities. And so really, over a period of time, what we want to get to is provide a temporal and geospatial real-time picture in Canberra of activity and how people move through different places and spaces, and how this is connected to different attributes of the physical unbuilt environment. And so we want to eventually be able to have a look at hot spots of activity where there's lots of physical activity and cold spots where people aren't doing anything. Thank you.